Hello everyone, welcome to CAPSA. Today we will learn about mast cell stabilizers. So what are mast cells? It is discovered by Paul Ehrlich in 1878. These are the membrane bound cells found in the loose connective tissues which contain granules rich in histamine and other mediators, and it plays a vital role in the allergy reactions and defense mechanism against the pathogen. We need to know what are the other mediators. Other mediators are like heparin, cytokine, growth factors, etc. Okay. Now, why did mast cells need to stabilize? Mast cells plays a vital role in the defense mechanism. Okay. So, when there is an allergen detected by the immune system, they send a signal to the mast cell to release histamine and other mediators. And the release of histamine through the mast cells occur through a process called degranulation, which makes the cells destabilize. Now, to stabilize the mast cell, we need some agents that are called as mast cell stabilizers. When histamine releases, what it shows? It causes mucus production, redness in the skin, and inflammation, etc. It shows a specific response known as triple response in pharmacology that is first introduced by Lewis in 1924. What the name? Triple response. So what are the triple response? That are a red spot, wheal, and flare. Red spot is due to vasodilation. Wheal is due to the consequences of increased permeability. And flare is due to an Axon reflex. Okay. Now, we need to know some examples or name of mast cell stabilizers that are Cromolyn sodium or sodium Cromoglycate, Ketotifen, Lodoxamide, Nedocromil sodium, and pemirolast. Cromolyn sodium or sodium Cromoglycate does not absorb orally. It is given through the inhalation route. But Ketotifen absorbed orally and shows the fast pass metabolism. Lodoxamide used in the prophylactic treatment and more potent than Cromolyn sodium. Okay. Now, how does MCS act? When calcium influx occurs through the mast cell, it causes degranulation. So, if we block the calcium channel or the calcium influx, it obviously prevents the degranulation and obviously stabilize the mast cells. So, a voltage-dependent calcium influx causes the degranulation process of the mast cell. So, they block the calcium influx and prevent the degranulations to stabilize the mast cells. We need to remember when the mast cell become destabilized and when the mast cell in the stabilized position. In the stabilized position, mast cell membrane shows a voltage 0 millivolt, that is resting membrane potential. When calcium influx occurs, the mast cell membrane goes to the destabilized state and the membrane potential is shifted to minus 40 millivolt. So mast cells become destabilized, degranulation process occurs, releases histamine and all the things. Okay. Now, what are the adverse effects? That is nasal congestion, headache, unpleasant taste, ocular itching, skin rashes, cough, etc. What are the clinical uses? That is bronchial asthma, allergic rhinitis, allergic conjunctivitis, chronic idiopathic urticaria. Chronic idiopathic urticaria is treated by Ketotifen because it has a antipruritic property. Okay, thank you for your attention.